Today we're diving into a complex but important topic: vascular rings and slings, and how they cause vascular compression on the trachea and esophagus. These conditions might be rare, but understanding them can be life-saving, especially for infants and children. So what are vascular rings and vascular slings? They are vascular anomalies, meaning abnormal formations of blood vessels. These structures form in such a way that they compress or encircle the trachea, which is your windpipe, and the esophagus, your food pipe. When this happens, it can lead to problems with breathing, swallowing, or both. Let's start with vascular rings. The most common type of vascular ring is the double aortic arch. Normally, the aorta, that's the major artery coming from your heart, forms a single arch that moves toward the left side of the body. However, in a double aortic arch, the aorta splits into two arches. One moves to the right of the trachea and the other to the left, fully encircling both the trachea and the esophagus. This complete encircling, or ring, puts pressure on these structures. For infants, this can lead to immediate symptoms like stridor, which is a high-pitched, noisy breathing, chronic cough, and dysphagia, or difficulty swallowing. This ring compresses both the windpipe and the esophagus, so children often have trouble feeding, may vomit frequently, and experience respiratory issues that might be mistaken for other conditions like asthma or respiratory infections. A less common but still significant type of vascular ring is the right-sided aortic arch. Here, the aorta runs to the right of the trachea instead of the left, which can be associated with another abnormal artery, the left subclavian artery, that passes behind the esophagus, completing the ring. This condition can compress the esophagus more than the trachea, so these patients often present with swallowing difficulties rather than severe breathing problems. Another important structure to mention in these conditions is the ligamentum arteriosum, a remnant of fetal circulation. In a vascular ring, this ligament can sometimes tighten the ring further, increasing the pressure on both the trachea and esophagus. Now let's move to vascular slings. These differ from rings because they don't fully encircle the trachea and esophagus, but they still cause compression. The most well-known vascular sling is the left pulmonary artery sling. In this condition, the left pulmonary artery, which carries blood to the lungs, doesn't follow its usual path. Instead of passing in front of the trachea, it passes behind it, wrapping around the lower part of the windpipe and causing compression. This can lead to significant breathing problems, especially in infants and young children. Symptoms of a vascular sling can include severe respiratory distress, wheezing that's often mistaken for asthma, and stridor that worsens with feeding or activity. So, how do doctors diagnose these conditions? Often the symptoms, especially respiratory issues that don't improve with common treatments, will prompt further investigation. A barium swallow is a common diagnostic tool. This imaging test helps visualize the esophagus as the patient swallows a barium solution. In cases of vascular rings, the barium shows a characteristic double indentation on the esophagus, caused by the compressing blood vessels. CT scans and MRI can also provide detailed images of the abnormal blood vessels and their relationship to the trachea and esophagus. Echocardiograms, ultrasound scans of the heart, can help identify associated heart defects, which are sometimes seen in patients with vascular rings or slings. Once diagnosed, most patients with symptomatic vascular rings or slings will require surgical treatment. The goal of surgery is to relieve the compression on the trachea and esophagus. For a double aortic arch, surgery typically involves dividing the smaller or more compressing arch to open up the space around the trachea and esophagus. This allows the patient to breathe and swallow more normally. In cases of right-sided aortic arch with an abnormal left subclavian artery, the surgeon might divide the ligamentum arteriosum to release the pressure. For a pulmonary artery sling, the surgery often involves repositioning the left pulmonary artery to its correct location so it no longer compresses the trachea. Most children who undergo surgery for vascular rings or slings do very well. Their symptoms, whether breathing difficulties, swallowing problems, or both, usually improve significantly after the procedure. However, some patients may need follow-up care, especially if there was long-term damage to the trachea or esophagus from prolonged compression before surgery. In some cases, tracheomalacia, which is the softening of the tracheal cartilage, can persist after surgery. This condition makes the windpipe more likely to collapse, so patients may continue to have noisy breathing for some time, though it often improves as they grow older. In summary, while vascular rings and slings are rare, they can have a significant impact on a patient's life if left untreated. Early diagnosis and treatment are key to preventing long-term complications. If you or someone you know has unexplained respiratory or swallowing issues, it's important to consult a specialist who can evaluate whether a vascular anomaly might be the cause. Thanks for watching, and I hope this helped explain the basics of vascular rings and slings.